Many people who fell sick with coronavirus in March or April are still not fully recovered. Their struggle shows how problematic this virus can be.
I try and I try, but as soon as I go a bit faster, my body says, no way.
Back in spring, hardly anyone was thinking about long-term health effects, especially not for young patients whose symptoms were mild.
Every week I think this can't be happening. It's just taking so long. I'd much rather be hiking up mountains like I normally do in summer.
How are doctors dealing with this still relatively unknown virus?
The most difficult thing is, we've only just started to understand the disease better. It's like running in a race where the rules keep changing.
This is the Schoen Clinic, located in the Alpine foothills of southern Germany. It's a rehabilitation center specialized in pulmonary disorders. 31-year-old Maria has been here for 3 weeks. She had COVID-19 back in March.
This is much harder for me now. I've always been very sporty, including cycling a lot. Both mountain and racing bikes. Now I can only put out 70 or 80 watts. It's crazy. It's way below my training level, and I still have pain in my lower lungs when breathing.
Maria was not in a high-risk group and did not require hospital treatment for the virus. But more than 5 months after falling sick, she's still not fit enough to work. Here at the clinic, she's been working on her fitness every day in the hope to soon be able to return to her job as a doctor.
I need a certain level of physical fitness to do my job, because I don't just sit at a desk. I have a lot of tasks that are quite physical, like changing the bandages on big wounds or running back and forth all day from the emergency room to the ward. Or if I'm in the operating room, I'm standing for 8 hours a day holding something, or stitching a wound.
Maria thinks she probably got COVID-19 at work in the hospital.
From the very beginning, my lungs hurt, and I got pneumonia and pleurisy. It completely bypassed my nose and throat area that you normally think are so key. I probably inhaled the virus directly. I was wiped out like never before. When I finally got the strength to get out of bed, I'd put some muesli in a bowl, but then have to go back to bed before I even got to eat it. It was an extreme exhaustion like I have never ever had before.
So we're going to do a 6-minute walking test. The aim is to walk as far as you can in the time allotted.
Eight weeks after falling sick, Maria went back to work. Even with pain medication, she only managed 9 days. In July, she tried again. When the increased pain levels and exhaustion returned, she applied to come here.
How breathless were you while walking?
Between 5 and 6.
You managed 720 meters, so you've increased from 671 to 720 meters. And it was actually the technique of walking that was the limiting factor, rather than being out of breath.
The head of the pulmonology department, Professor Rembert Kutschuller, says Maria isn't an isolated case. Patients who are young and fit with no pre-existing conditions and requiring no hospital treatment for COVID can still experience health problems months after contracting the virus.
We can see from the number of people seeking help that there are more patients suffering from post-COVID problems than we thought even just a few months ago. And it's not just the classic older patients like we initially saw in the statistics. There are young people whose lives have suddenly been turned upside down, for example, because they're not fit enough to work.
Every patient that arrives at the Schoen Clinic suffering from after effects of COVID-19 undergoes a detailed examination. To understand this virus fully, doctors from different fields of medicine need to work together.
I think it's important to be honest at this point and to say that we're in a learning process. Through the large amount of new data that we're getting every day here, we can learn more about this virus. We try to pass on our findings to others too. A lot of this data still needs to be checked. We don't have a particular treatment strategy in the classic sense because we don't have years of experience to draw on, or a book with treatment recommendations from the last COVID outbreak. We're learning as we go. As we care for these patients, we're discovering what kinds of problems the virus can produce.
By now, doctors know that COVID-19 affects multiple organs.
From lung problems to hair loss, to sleep disorders, fatigue, and neurological disorders. Then critical illness polyneuropathy, heart problems, plus issues resulting from the treatment in intensive care. We're seeing a multitude of problems, and the list is growing. I don't think we would have expected such a variety of issues.
Maria has now moved on to the next examination, spiroergometry. The aim is to test how her lungs and other organs perform under physical exertion. She has one more week at the clinic here in Bavaria. Berlin. The German capital has seen well over 80,000 cases of COVID-19 since the start of the pandemic. Of those, around 80% have recovered, officially. But, like Christopher Bley, not all of them are fully restored to health.
I really have to catch my breath. It's tiring. I've never been like this before. I could go up these stairs and could go straight back down and up again. Now climbing stairs is an act. Whenever I have to walk uphill, I get out of breath.
Christopher Bley caught COVID-19 in mid-March. All 4 members of the family got infected.
We don't really know how we got it. We were in Austria, but not in Tyrol, where it was bad. We came back on March 1st. My oldest daughter went back to kindergarten for 7 days. The virus was in the news, but not big yet.
At the beginning of March, most people didn't see the virus as a major threat or the start of a global pandemic. So Christopher didn't take his symptoms too seriously.
My oldest daughter had started kindergarten the previous summer, and since then I'd had a permanent cold. So I was used to having cold symptoms. On holiday in Austria, I still felt fine. Then we came back and I developed a sore throat and a bit of a cough. Nothing serious. I didn't have a temperature. Neither did my partner. The children had a slight temperature, but that's not unusual. Children often do. It was all relatively unproblematic.
Once their quarantine period was over, they were considered officially recovered and were allowed to leave the house again. But 1 month later, both Christopher and his partner Steffi developed new symptoms.
It was quite a long time before we realized that what we were experiencing was linked to COVID-19. I have allergies, and in May, the start of the allergy season, I suddenly started getting short of breath, which I never had before. I usually took an antihistamine. I had these few problems, but nothing special. So I thought, wow, my allergies have gotten worse. But I didn't link it to COVID-19. I kept going out on the balcony because I felt I had to get some fresh air, and I'd bend over to catch my breath. I'd have that about every 2 days. But then it rained, and normally that would mean all of my allergy problems disappear. But I still got it, and that's when I knew something was wrong.
So Christopher went to a general practitioner. But he wasn't really able to help.
The doctor did link my symptoms to COVID-19, but they weren't life-threatening and not that major. Plus, my fitness levels matched my body weight.
Christopher has also recently developed an underactive thyroid, which has caused him to put on a lot of weight, 17 kilos to date. It's not yet clear whether COVID can affect the thyroid gland. In the past, Christopher ran in the Berlin Marathon, but there's no way he could manage that right now. Christopher's partner, Steffi Puchstein, also experienced problems after having COVID-19, but her symptoms were quite different.
I felt dizzy and it just wouldn't stop. I went to pick up my daughter, Romy, and everything would just spin and spin. I was afraid that it might never stop, that this could be the new normal for me.
After 4 months, Steffi's dizziness finally tapered off. It's now known that COVID-19 can trigger neurological issues. Christopher is hoping that his breathing difficulties will also disappear in time. International studies show that the lungs and heart can indeed recover from the virus, given time. A test shows Maria's lung function is now back to normal, 5 months after she caught the virus.
On the one hand, I feel good because I'm getting lots of therapy here. But on the other, I keep thinking, what will it be like after the therapy, when I go back to work? And how will things progress with this illness? Will there always be issues, or will I get back to the same level of fitness and quality of life that I had before?
Maria was lucky to get a place here. Waiting lists for patients with post-COVID problems are long. The Schoen Clinic alone has a huge number of patients waiting for treatment. Maria's time here has now come to an end.
In terms of fitness, tiredness levels, fatigue, have you noticed any change?
That may have changed, but I probably won't know until I get back to work and see whether I can cope better with an 8-hour day or if I'm still as tired.
What about the chest pains?
The pain is better when I have therapy the whole time. I noticed over the weekend, where there's less going on, or when I had Physio Wednesday last week, and then the next time on Tuesday, that the pain in the base of my lungs returned.
We're seeing patients who have symptoms, some of which we can't really explain. And so we're trying to find answers and treatments. It's like a black box. And whenever I can't explain and convey something in a way that's well-founded, it leaves a sense of uncertainty. I freely admit that.
The after effects of the virus are gaining increasing attention in COVID-19 research. At the end of October, Germany's University Medical Center Schleswig-Holstein launched the largest study to date on the long-term effects of coronavirus. Professor Thomas Barmer and a diverse team of doctors are examining 2,000 former COVID-19 patients in Germany who are no longer positive and are listed in the statistics as recovered.
We certainly know more than we did back in February, March, or April, because now the phase is beginning where we can start to understand the after effects of the virus. But the question is, how do you define an after effect? We now have 6 months' worth of after effects. But of course, a virus like COVID-19 could cause symptoms that don't appear within 6 months. You might have long-term effects that emerge after 5 or 10 years.
The study is focusing on the lungs, heart, kidneys and liver, as well as the nervous system and metabolism. Andreas Thümer is one of those taking part. Back in March, he was here in intensive care and in an artificial coma for 7 days. When he heard about the study, he applied immediately.
I hope it means that I'm now being monitored, so that if there are any after effects, they can respond.
It's only if lots of people take part that we can gather information that can then be available for others.
Professor Barmer and his team are also examining post-COVID patients who didn't require hospital treatment. The doctors fear that even patients who had mild symptoms could still suffer long-term damage.
There's a wide range of symptoms that we as doctors are confronted with, where we need to differentiate carefully. What can be attributed to the virus that may have been directly caused by it? And where do we need to exercise caution and not just put everything down to corona? We need to continue doing our work thoroughly as before, while taking COVID-19 into account. So the next thing we'll examine is your liver.
The study also looks at whether damage to the liver can result directly from being infected with the virus.
The most difficult thing is, we've only just started to understand the disease better. It's like running in a race where the rules keep changing, where some of our findings from 3, 4, or 5 months ago already need to be reevaluated. That's a very important process, and it's moving very fast. I don't think we've ever had an illness where there's been such an enormous increase in knowledge in such a short time.
As part of the study, the subjects will be monitored for up to 10 years. That's the only way to collect data on possible long-term effects.
And tongue out?
The study is also monitoring the subject's sense of taste and smell. Many COVID patients report an impairment or even complete loss of these senses.
So we're trying to draw expertise from all medical fields, bringing in all the various disciplines that we now know to be relevant, so that in the end, we get scientific knowledge, and the patient, an assessment from different medical specialists.
Well over 1 million people in Germany have now recovered from the coronavirus. Writer Nina Marevsky is one of them. After a short holiday in Valencia, she started to show typical COVID symptoms. That was in mid-March. But the test centres and her doctor refused to give her a test, so she paid for one herself. The result, positive. By April, she was no longer positive. Months later, she still didn't feel well.
It was distressing psychologically. My hair started falling out. It started very slowly. There was more hair than usual in my brush and in the shower. Then over breakfast one day, my husband said, "You've got hair all over your shoulders." I felt like I was falling apart.
She has also suffered heart palpitations and chronic fatigue. Her doctor did not link these new symptoms with her previous COVID-19 infection. After completing her time in quarantine, she started writing about what she'd been through on Facebook. At the time, she didn't know that she would have more symptoms to deal with later.
I had a mild case. I was only in hospital briefly, didn't need a ventilator and didn't have pneumonia. I posted a photo of my positive corona test and wrote about how it felt to have the virus. I realized that many people felt a real need to know more about this illness. People started writing to me because they were experiencing the same things. They were sick but weren't getting help or were seeking advice. And I discovered that many were feeling very, very helpless.
She also wrote online about her experiences with later symptoms. Nina and other COVID long haulers talk regularly on social media.
One man who's taking part in a medical study wrote and told me that he and his wife have both sustained damage to the heart. It's in the paper again today. A study by scientists at the University Hospital Frankfurt shows alarming findings on the impact of the coronavirus on the heart. The virus can cause serious damage to the heart. Thankfully, it's now slowly coming to light. It's scary, but I'm glad that the media are now finally reporting on how dangerous this really is.
Nina Marevsky has found new friends through the articles she's posted online. Angela Callan from Ireland is also struggling with symptoms long after having COVID-19. She was a singer before she got sick, but still can't work.
I'll call Nina and she'll say, oh, I've got this or that. And I'll think, oh, God, I've got that too. Or she'll say, no, it's getting better. It's been a great support.
Yep, an anchor.
You need someone else who has the same illness and understands what you're going through.
Angela is also suffering from fatigue, something many post-COVID sufferers complain of. How and why the virus leads to chronic fatigue is still unclear.
Are you tired all the time too?
Yeah.
I have this tiredness that comes really suddenly. Do you get that too, that you feel super and then suddenly you get a day where you can't do anything at all?
Yeah, but after 5 months, I don't get that as much, thankfully.
Yes, but when you get it, it's like a flashback. You start to panic that you're getting sick again.
Yeah, you definitely feel afraid. It's not to be underestimated. I was in great shape. I never thought something like this would happen to me. It all happened so fast. I felt like I'd been hit by a steamroller. Within hours, I was unable to move.
The two women find it hard to understand how some people can make light of the virus.
We know that we need to take it seriously because we both know how awful it is.
Awful.
I've lost contact with some people a bit who just rolled their eyes, or even friendships ended because some people don't recognize the danger and think these public restrictions are the problem, not the virus.
Angela misses her family back in Ireland. She hasn't stepped on a plane since the start of the pandemic. Even though she now has antibodies, she's too afraid of getting reinfected.
Fear can be so debilitating.
It doesn't help you get better.
Not at all. You need to be careful and stay informed, but you can't eliminate everything.
Back in Berlin. It's now mid-September and Christopher Bley feels he still can't breathe very well. It's now been 6 months since he had the virus.
In the last 4 weeks, I've really struggled at times. Some days I wasn't able to do any sport at all. And some nights I've woken up unable to breathe. My chest felt really tight, and I couldn't get enough air. It's better again now, but only since 3 days.
Christopher works as an insurance broker, so he can do his job even with symptoms. But his condition is causing him psychological stress.
I'm going to the doctor because it's just not getting better. I kept thinking I'm improving, but I'm not.
Dr. Matthias Krüll is a lung specialist. He's treated more than 30 post-COVID patients in recent months. Many of them were not in a high-risk group, just like Christopher.
It feels like I'm not getting enough oxygen. I don't know what I should do then. I just don't know what to do.
Being unable to breathe properly is scary. People with those problems always try to take things easy. And if that continues, and you always have that uncertainty, you stop pushing yourself and don't build back up your previous training habits. And your body suffers as a result.
As long as I could breathe through my nose, it was okay. Once I couldn't, it went downhill rapidly.
Whatever effect this virus had on you and your lungs and alveoli during the acute phase and post-acute phase, I can't see any deficits anymore as regards the exchange of oxygen and CO2. No diffusion impairment, as we say. It's very important to show that there's no serious physical impairment, because faith needs to be restored. Confidence in your own body. That's the most important thing now.
I'm really relieved, because I now know that there's no damage that's been left by the virus. I'll get the other things checked out. But he already indicated he doesn't think it's going to be a problem, so I can get back to normal.
Unlike Christopher, Maria is still not doing well. Since returning from the clinic, she goes out to the forest as often as she can to go walking and build up her fitness.
The clinic certified me unfit to work. I definitely still couldn't do a physical job, which is what my career requires. I'm supposed to do 24-hour shifts as well, where I have to cover the entire hospital. If there's an emergency, if someone needs to be resuscitated, I get an alarm on my phone and have to run over. And I'm then responsible for resuscitating the person. But I just couldn't physically do that right now.
She is managing to work, but only for a maximum of 7 hours a day. And it's mostly office work, behind a desk.
I've been sick now for more than 6 months. I really can't be bothered with it anymore. I just want it to be over. But okay, this is where I am right now, and I just have to make the best of it.
New studies on the after effects of COVID-19 are now appearing almost daily. But for people like Maria, who are struggling with the symptoms, many questions remain. After 6 months, Christopher Bley has recovered. His next goal is to run another marathon.